Pharmacy Tech Exam 2026 Practice Test and Study Guide, 25 Key Questions. Question 1. How many times can a Schedule 3 or 4 prescription be refilled? No refills. Up to 5 times in 6 months. Up to 11 times in 1 year. Unlimited. CII and CIV drugs are limited to 5 refills within 6 months of the original date. Question 2. What is the DEA Form 222 used for? Reporting theft, ordering Schedule 1 and 2 substances, destroying drugs, registering a pharmacy. Form 222 is required for ordering CII medications. Question 3. Which organization oversees the Combat Methamphetamine Epidemic Act? FDA, DEA, FBI, OSHA. The DEA regulates the sale of pseudoephedrine under the CMEA. Question 4. What does the SIG code AC mean? After meals, before meals, at bedtime, twice a day. AC stands for anti-SIBUM before meals. Question 5. Which medication is a look-alike/sound-alike LASA for Adderall, Inderal, Ambien, Ativan, Advil? Adderall and Inderal are common LASA pairs. Question 6. What is the maximum amount of pseudoephedrine a person can buy in 30 days? 3.6 grams, 9 grams, 15 grams, 1 gram. CMEA limits sales to 3.6 g/day and 9 g/30 days. Question 7. Which drug class does lisinopril belong to? Beta blocker, ACE inhibitor, diuretic, statin. Lisinopril is used for hypertension and ends in pril ACEI. Question 8. What is the brand name for atorvastatin? Zocor, Lipitor, Crestor, Pravachol. Lipitor is the brand name for atorvastatin. Question 9. Which auxiliary label should be on a suspension? Refrigerate, shake well before use, for external use only, avoid grapefruit. Suspensions contain particles that settle and must be mixed. Question 10. What is the Purple Book used for? Pricing, biological products and biosimilars, therapeutic equivalents, veterinary drugs. The Purple Book lists biological products and their biosimilars. Question 11. An allegation is used to find what? Price of drugs, quantity of 2 different strengths to make a specific concentration, expiration date, the dose based on weight. Allegation is a math method for mixing concentrations. Question 12. Which controlled substance schedule has the highest potential for abuse but has a currently accepted medical use? Schedule I, Schedule 2, Schedule 3, Schedule 4. CII drugs have high abuse potential but are used medically. CI has no accepted medical use. Question 13. What does HIPAA protect? Pharmacy profit, patient privacy and health information, the safety of employees, the cost of drugs. The Health Insurance Portability and Accountability Act protects FI. Question 14. The root gastro refers to what body part? Lungs, stomach, heart, liver. Gastro refers to the stomach. Question 15. Which medication should not be taken with grapefruit juice? Penicillin, simvastatin, aspirin, metformin. Statins like simvastatin interact with grapefruit juice, increasing side effects. Question 16. How many milliliters, ml, are in 1 teaspoon, TSP? 1 ml, 5 ml, 15 ml, 30 ml. 1 teaspoon equals 5 ml, 1 tablespoon equals 15 ml. Question 17. What is the Orange Book used for? Pricing, therapeutic equivalents, generics, animal drugs, vaccines. The Orange Book helps determine if a generic is equivalent to a brand. Question 18. Which drug is used to treat type 2 diabetes? Lisinopril, metformin, amoxicillin, warfarin. Metformin is a first-line treatment for type 2 diabetes. Question 19. What does BID mean? Once a day, twice a day, 3 times a day, 4 times a day. BID stands for bis and die, twice daily. Question 20. A pharmacy technician is asked to reconstitute a medication. What does this mean? Crush a tablet, add a liquid, diluent, to a powder. Mix 2 creams. Check the expiration date. Reconstitution is the process of adding liquid to a powder form for administration.